Hi, you're here today for pre-op for Dr. Misty Suri's knee surgery. The first thing you're going to receive is you're going to receive a red folder, and inside of it it's going to contain all the important information and documents for your upcoming surgery. We strongly recommend that you read over all of the pieces of paper that are inside the folder because they explain everything you need to know for surgery. One of the sheets you'll find in your packet is going to look like this. You'll have 2 copies of this exact packet. The reason for that is one copy is yours to keep and write on and take notes. The other copy is going to have written on the top, "Bring to surgery." We want you to bring that copy with you on surgery day because Dr. Suri will fill that out after your knee surgery with exactly what he did, and it'll have your post-op instructions on it with all important information for you to follow after surgery. He's going to discuss that sheet with your family member, and that'll go home with you after surgery. Following your ACL reconstruction, you're more than likely just going to have one incision about that long, and it's going to be a straight line down the center of your knee, overlying your patella tendon area. This incision is going to be stitched up with dissolvable stitches, and then it's going to have steri strips overlying the incision, helping to hold the skin together. There is a very small chance that you could possibly have another incision somewhere. If you do, that incision will also be covered with steri strips, helping to hold the skin together. If it's not covered with steri strips, then it's not another incision, and you should usually only have one incision. On top of the steri strips, you're going to have a little yellow square of zero form dressing, and then you're going to have gauze wrap wrapped around your knee. We want you to leave that gauze wrap on your knee and in place for 2 to 3 days after surgery. Don't take it off, don't get it wet. It's going to have a TED hose compression stocking over the top of it. We want you to leave all that in place for 2 to 3 days. Don't get it wet. You can take the TED hose stocking off if you want to sponge bathe. On the 2nd or 3rd day, you can unwrap your knee. Once you unwrap your knee, you're going to see those 2 little yellow squares of zero form dressing. You can take those off and throw them away. Leave the steri strips on your knee, which are covering your incisions. And then at that point, we want you to get some waterproof NexCare bandages. So that's right here, waterproof NexCare bandages. You can really get any kind of waterproof bandages. It doesn't have to be NexCare. That's the ones that we use commonly, but you can get any kind of waterproof bandages, and we want you to cover those incisions with the waterproof bandages. Once you do that, then we allow you to shower. But we want those incisions to stay clean and dry for 2 weeks after surgery so no infection or water gets into the incisions and causes problems. If you can't find waterproof bandages or you can't find the right size to fit over your incisions, you can always get clear cooking saran wrap and wrap that around your knee, and you can secure the top and the bottom of the saran wrap with some tape, and then you can shower that way. The cooking saran wrap will help to keep your knee dry. You can also always use the clear cooking saran wrap with the waterproof bandages if you don't trust the waterproof bandages. Always take the cooking saran wrap off once you get out the shower. But we want your incisions to stay covered with a bandage for 2 weeks after surgery, and then we'll let you more than likely shower normally. Also, you will notice that you have some removable sticky TENS unit pads around your knee incision. So you're going to have 2 pads above your kneecap on both sides and 2 pads below your kneecap on both sides. You'll see the wires sticking out from underneath the gauze wrap after surgery. Those wires plug into your TENS unit that you may have been shipped from Zynex, which is our TENS unit company that we use. That device plugs into those electrodes and it sends electrical impulses to the muscles to kind of stimulate the muscles and block them from recognizing pain after surgery. That's an optional device that you can decide if you want to use or not after surgery. You don't have to use it. but we recommend it to help pain control. It's not going to help you magically heal faster or slower. It just helps to control pain. If you don't get the TENS unit device, then when you take your dressing off your knee, you can peel off the sticky pads and just throw them away. Following your ACL surgery, you will go home with some equipment. You will need something to help walk and get around. Usually that is crutches, but you also have the option if for some reason you need a walker. Those things will be fitted to you at the hospital after surgery. If you have your own pair of crutches and you'd like to use those after surgery to help save a copay from your insurance, then you do need to bring that equipment with you to the hospital. If you don't bring that equipment with you to the hospital on surgery day, we will assume that you do not have any equipment and you will be required to take an additional pair of crutches or a walker. You will also get a knee brace, and you'll get a ice unit, and all those things will be on you when you wake up after surgery, and you're going to go home with them. You're more than likely going to be in a knee brace like this. Underneath it, you're going to have a Polar Care ice pack that's already going to be Velcroed to your knee, and you're going to be all set up just like so. Obviously, you're not going to have the green scrub pants on underneath the brace. That's just how I'm doing it right now. You'll have your bare leg with the Ted Hose compression stocking in place of my green scrubs. The ice pack here is a good little device that'll be on and running when you come out of surgery. And you're going to go home with this ice unit. You're going to get one of these Breg Polar Care ice cubes, and you're going to have the ice pack that's going to be Velcroed onto your knee. And so the tubing here for the ice pack plugs in to this tube like so. It snaps, and then you fill this cube up with ice and water. You plug this into the wall, you turn it on, and it circulates the cold water through the ice pack here to keep the knee iced down. We instruct you to use this 20 to 30 minutes on, 20 to 30 minutes off. As long as you're doing that, you can do that as many times per day as you need to. That's going to help to keep down pain and swelling in the knee. We don't want you to just leave it on all day because it can get your knee too cold and cause you to have frostbite in your knee. And you should always have something between the ice pack and your skin. You're going to wake up in the knee brace, and it's more than likely going to be locked straight out in extension. So it's going to be locked to where you cannot bend it at all. Locked straight. And that's because we don't want you to injure or mess up what we just did in surgery. You're going to have further instructions all laid out on a post-op sheet that Dr. Suri gives your family, explaining exactly what we want you to do with this knee brace. More than likely, you're going to have some kind of combination of keeping the brace locked, and you may need to do that at all times, or keeping the brace locked at certain times and unlocking it at other times. To unlock the knee brace, these two orange little knobs on each side of the brace can be pushed up, and that unlocks the brace and lets you bend it to our preset degree range that we have on the side of the brace. We don't want you to adjust these degrees on the side of the brace. It'll already be set for you. We only want you to touch the orange tab here to lock it by pushing them down, or unlocking it by pushing them up. Only change these degree settings if you're instructed to do so by Dr. Suri, myself, or one of our team members, or physical therapy. Initially after surgery, we only want you taking the brace off to shower, unless otherwise instructed. But you will need to likely take the brace off at certain times. To do that, you can just unclip the hooks of the brace. Sometimes that may be a little difficult to do without unvelcroing this top strap. So you can unvelcro the top strap, and then you can unhook it from the side over here, And when you do that all the way down, that'll let you take the brace off. When you're going to tighten the brace, what you should do first is you should flip this little side switch here. This lets you adjust the tension in the back of the strap here. So once it's down, you can't tighten it anymore. So when you're going to tighten your brace, you want to unlock this first, pull the slack out in the back, flip this down to secure it and lock it in place. Then hook your strap over here. Then tighten the tension in the front strap, like so. To secure the tension in the front strap, you will need to Velcro down this front strap, and then it's not going to move or change. If this strap is too long, you can always unvelcro it here, and you can either trim this strap, or what I like to do is just kind of fold it under, like so, and then you can Velcro it down to different areas here. If you do trim it, make sure you don't trim it too short, because you may have different thickness of clothes on versus just a bare leg, and that can change how long this strap is. You can do that for all the straps up and down the brace. Another way that you can adjust the brace is by locking and unlocking this piece on the side here, and that lengthens and shortens the bars on the side of the brace. So once you get it to the desired height, you can line it up and then lock this to secure the bar in place. You can unlock it and move it, or you can lock it to secure it in place. And you can do that down here, up here, and then on the other side as well to make your brace a certain length. After surgery, depending on the certain type of surgery that you had, you may be instructed to limit how much weight you put on your surgery leg. So, depending on what surgery you have, we'll give you different instructions, but usually in the beginning, we'll want you to do that with your brace locked straight. So when you go to lock the brace straight, if it gives you trouble locking it, that means that the bars aren't all the way straight. So make sure your bars are all the way straight, and then it should let you lock it in place. You may need to push it with your other hand to also help lock it. Then, when you're up, moving around, we may tell you to just put toe-touch weight bearing on your surgery leg. So that is just gently touching the toes to the ground. So just gently kind of touching the toes to the ground, almost to where you could slide something kind of under your foot. So it's usually about 25% weight bearing, just gently touching the toes to the ground. You would be doing this with crutches to assist in doing that. You always want to have crutches when you're putting partial weight on one leg to help to make sure you don't fall or trip. We also may tell you to put no weight on your surgery leg, and obviously that is just not putting any weight, not touching your toes to the ground really at all, or if you do, I mean, you can't even feel the amount of weight on your leg. Next, we're going to talk about eating prior to surgery. We're going to call you with an arrival time for your surgery. Whatever time we give you, there's no eating 8 hours prior to that arrival time. This includes gum, hard candy, mints, chewing tobacco, or anything you put in your mouth. Once you're inside of that 8-hour window, you can continue to drink water or clear Gatorade up until 2 hours prior to your arrival time for surgery. We do want you to drink some water or clear Gatorade prior to surgery, because that helps to keep you hydrated, which helps things to go well for surgery. But once you're inside of 2 hours prior to your arrival time, we don't want you to eat or drink anything until after surgery. The next sheet you'll find in your packet of papers will be a sheet that instructs you to call us between 12 p.m. and 4 p.m. the day before surgery to find out your arrival time for surgery. You only have to do that if you do not hear from us by 4 p.m. Otherwise, We will call you the day before surgery between 12 and 4 p.m. to let you know your exact arrival time for surgery. That's because Dr. Suri has some surgeries come and go off of his schedule, so we will finalize the surgery schedule the day before surgery and call you to confirm your arrival time. Your time will likely be early in the morning, sometime between 5:30 and 11:30 a.m. The time that we tell you is very important, and it's important to arrive promptly at that time. We have to prep you and clean you for surgery, and if you arrive late, this could cause a delay in our surgery schedule and could cause your surgery to be delayed, and it could get pushed to the end of our surgery schedule that day. The other thing is we want you to get either Hibiclens cleaning soap, which is a strong antibacterial soap, or Dial antibacterial soap, which you can find at any pharmacy. Both of those soaps can be bought without a prescription. We recommend the Hibiclens, and we want you to shower from the neck down the night before surgery and the morning of surgery to get you as clean as possible. It is important to scrub the surgical area thoroughly, but not too hard to cause abrasions. On the day of surgery, after you shower in the morning with the soap, we don't want you to put anything on your body. No deodorant, no body lotion, no cologne, no perfume. We want your skin as clean as possible for surgery. It's important that you remove all jewelry, metal, piercings from your body prior to surgery. If you have a piercing or ring that you cannot remove from your body, it's important that you address that with us or anesthesia prior to surgery. Also, please be careful not to get any cuts or abrasions around your surgery site prior to surgery. I would not shave your surgical extremity. We will do that on the morning of surgery. If you get any new cuts or abrasions around your surgery site, we may have to cancel surgery for risk of infection. In your packet of papers, you will have some information on your TENS unit that will be supplied to you by Zynex Medical. They will call you to let you know that we have sent them a prescription for a TENS unit, and they will want to ship it out to your house. In your packet, you will also find a sheet on how to take pain medicine. It's got some things with examples of how to do it and explains to you how to rotate or alternate your pain medicine. At the bottom, we have an option for severe pain that you can follow if you're taking all the pain medicine as it's prescribed and you're still having severe pain. These options let you do little small increased amounts or frequency of those doses for little short periods of time, so you can always read over that. Some tips are that pain medicine contains Tylenol, and it's also important that you do not exceed 3,000 milligrams of Tylenol in a 24-hour period. That's also at the bottom of this sheet. The next thing you'll notice in your packet is a sheet that goes over warning signs for blood clots after surgery, which are also called DVTs. This sheet goes over signs and symptoms of a blood clot. Surgery puts you at risk for blood clots, and those can occur in any extremity after surgery, your arms or your legs. It's important that you know the signs and symptoms, and if you think you're getting a blood clot after surgery, please call us so we can address those concerns. And if we suspect a blood clot, we will more than likely have to get an ultrasound to rule that out to make sure that you don't have a blood clot. If you can't get in touch with us and you think you're getting one of these, we suggest go to the emergency department for surgery. It's also your responsibility that if you are over the age of 40, you get surgery clearance from your primary care doctor. We should have instructed you prior to surgery if you needed this or not. If you are instructed to get it, it's your responsibility to get this prior to surgery. And if for some reason you do not have this prior to surgery and we do not have documentation in our office, your surgery procedure will be canceled and delayed until we get it. It's also important to remember to read over the information and the pieces of paper that we have given you prior to surgery. The videos are a good tool to help you get prepared for surgery, but the packet may contain a few small things or some more details that were not discussed in these videos. Between the videos and the information in the packets that we have given you, you will be prepared for surgery and know everything you need to know to have a great outcome after surgery.